Every 3 seconds, someone in the world develops dementia. Every 6 seconds, someone suffers a stroke. These are not just statistics. They are stories of mothers who forget their children's name and fathers who lose their ability to speak or walk. What if I told you that many of these tragedies could be prevented? Today, I invite you to imagine a brain-healthy society, a world where stroke and dementia are no longer inevitable or preventable. To get there, we must unite 3 forces: innovations, policy, and community action. Stroke and dementia are often seen as separate illnesses, but in reality, they are interconnected. Stroke can lead to a type of dementia called vascular cognitive impairment, which now affects millions globally. In Indonesia, stroke is the leading cause of death, and dementia are rapidly increasing. This is especially alarming because Indonesia is now in a demographic transition, moving toward an aging population. By 2035, it is projected that almost 17% of our population will be aged 60 and above. As the number of older adults grow, so does the risk of age-related brain disease. The burden is heavy, not just for the healthcare system, but for families, caregivers, and our economy. These conditions rob people not only on their memories and independence, but also their dignity. And yet, many of these cases are preventable through early intervention. Today, innovation gives us powerful tools to protect brain health. Wearable devices and mobile apps can now help monitor blood pressure, track diet, and encourage physical activity. Key factors in preventing stroke and dementia. Artificial intelligence can analyze speech pattern to detect early signs of cognitive decline. Telerehabilitation allows stroke survivors in remote areas to access therapy without leaving their homes. These technologies are not futuristic dreams. They are already exist. What we need is the political will and public trust to integrate them into health system equitably and ethically. Technology alone is not enough. Without supportive politics and financing, innovation remains a privilege, not a right. In countries with universal health coverage, like Indonesia with its Jaminan Kesehatan Nasional, we have an opportunity to include brain health services as part of essential care. Imagine screening for dementia at a primary care, regular cognitive checkups for the elderly, and accessible medication for stroke survivors, all covered by national health insurance. But this requires cross-sector collaboration between policymakers, clinicians, and researchers. And we must remember, brain health is not only about treatment. It is also about investing in prevention. The journey toward a brain-healthy society begins at the community level. Puskesmas, our frontline healthcare, can become hubs for stroke and dementia prevention. With proper training, health workers can educate families about healthy diets, hypertension control, and mental stimulation for the elderly. Community caregivers can learn how to support patients with memory loss with compassion and skill. In schools, we can start early, teaching children about the importance of brain-friendly habits like reading, exercise, and social interaction. In short, prevention must be a way of life, not just a health campaign. The brain is the command center of our lives. Our memories, dreams, relationships, and identity all reside there. To protect it, we must innovate wisely, finance fairly, and act collectively. Stroke and dementia may seem like medical problems, but their solution are interdisciplinary. Let us not wait for more lives to be lost, more memories to fade, and more families to suffer. Let us take action together for a future where brain health is not a privilege, but a universal right. Because a brain health society is a stronger, wiser, and compassionate society. Thank you.